Yes.
Hey, and welcome back from all your travels.
Thank you.
That's awesome. It looks good when I drive by, yeah,
Yeah,
I mean, from the
it's,
outside.
Inside, not so much right now. Actually,
Be on schedule again, or?
a little bit. They didn't get enough. They didn't get enough siding. So, because they wanted to reuse as much as they could,
Right.
and it turned out there was a little less they could reuse than they thought.
Okay,
So it slowed things up for
oh, okay,
a bit while
Oh.
they ordered more.
yeah,
We say ordered,
yeah,
it's in process.
So it came in, they finished, but you know, the building inspector couldn't sign off
Oh,
until it was, yeah, so.
Danielle, there's someone else who
There's
is
someone
the,
else.
Signed off on the rough work
the attendance.
today.
alright.
Oh, is that Sharon?
Yeah, Cheryl, okay.
Installation Wednesday,
Phew.
and he wants to come back after installation's done before they start putting the drywall up,
Okay.
so
It'll move quickly, but yeah.
that's what I'm hoping.
Yeah.
And I'll just give it a couple more minutes. Anita was gonna try and join.
Okay.
She wasn't sure she'd make
I
it.
know, what times we've done, there's something about having drywall, you go, oh, you can feel like it's almost done, yeah.
You know, when you stop seeing through.
Yes. It's like, oh, this is the size of the room. Hmm.
Yeah, my neighbor's doing a massive thing like that, and
We need to move the alley.
he's taking down his
I don't.
underneath
I
garage.
don't wanna touch that.
He's extending the whole thing, so he had to dig, you know, other foundation.
Yes, yeah.
Doing all that.
Oh, it's-
Yeah.
What?
They've been out, so that's, I believe Southern.
Oh, okay, oh, you see that, oh.
Yeah,
Oh,
so they've
okay.
been living in Avalon Bay since April.
I have no idea, really? Wow,
And so who knows how long, I mean, they
don't
just
say that
started
to me.
the demolition.
We've been living in
I know.
our place since, you know, since
February,
March, we moved in
yeah.
in March.
Wow.
Yeah.
Yeah, we didn't have to
So,
leave the house. for
we're-
so.
We were hoping that we would be done by the end of July.
Mhm.
I think it's gonna be a
Okay, let's
bit-
get started.
Okay.
Okay. Good evening, everyone, and welcome to the Bedford Board of Health meeting for Monday, June 15th, 2026. I'm Susan Schwartz, and we have a quorum in person, but because another member may join us via Zoom, if we could just do a roll call.
Sure.
David Karen?
Maureen Rucci,
Be Bronkhorst?
Susan Schwartz, and thank you all for joining tonight. Is there anyone online or in the room who wants to offer any public comment?
There's
If
no
there
one,
is-
there's no one online. There's just Cheryl, who's, you know, who'll be up in a little bit, and Mike from Bedford TV.
Okay, cool. And seeing no one in the room as well, open and closed public comment. Starting with health department staff. Marisa, do you want to go first or Jackie?
Yeah, I'll go first.
Okay,
Sure. So an update for my report from May 4th to June 10th. There were 6 annual food inspections. Most of them happened after the window that the June 10th window. But some of the violations that were listed, raw chicken, this seems to be another common theme we talk about monthly. The raw chicken is stored above ready-to-eat foods in the reach and refrigerator. Date marking, cold holding, those were some violations. Employee illness reporting procedures. Not only was that not in place at one food establishment, but the employees didn't seem to provide any evidence that they were informed of these reporting responsibilities. And again, as we've seen, the posted signage for some reason there's some issues with that still. So that was either absent or expired for 2 places. And I just mentioned a couple of others. The salad on the service line didn't have temperature control, so that was out of temperature in the danger zone. And then there were expired sanitizing test strips at one location. Most of the violations were corrected upon reinspection. We received 1 food complaint. And that was that a restaurant patron found a string in their brown rice. And they were also concerned about food safety when imitation crab was cold. So there was an inspection for that. There were no violations found, but they did find, the inspector did mention that there was potential contamination of that string that was possibly from the sack that the brown rice was held in. So the inspector asked them to transfer the rice to a different type of food container. One that's accredited, such as NSF. So we wouldn't have those strands anymore. Temporary food events. So we're starting in full swing here. There were
Wow.
21 permits issued, but that doesn't mean there were 21 events. So one event had multiple permits. So that was one event, one place had 6 permits issued. Another had 2 issued, but there were a lot of events this year already. At an apartment complex, there was 1 inspection, but 2 re-inspections for the same place because they weren't able to correct those violations. As far as nuisance inspections, there were 2. Somebody complained that there was a dishwasher left outside of a food establishment for over a month. And another complaint, a neighbor was concerned about potential animal welfare and sanitary issues at somebody's home, their single unit dwelling. That inspection, there were actually multiple visits to that home, even though I wrote that there were 1 to 2 re-inspections, but we were trying to, just because of the nature of the complaint, we didn't wanna schedule it. We wanted to show up to see the actual conditions, but because you're going to somebody's home, you have to either hope that they're home, hope that they are allowing you to discuss this with them, or you have to schedule it. So there is an update to that, outside of this report that we did. I went with the animal control officer, we did conduct an inspection, but they wouldn't let us in, so we're gonna have to try to go back, and she was on board with scheduling for that. So we'll have to see how that goes. But they did have ducks and chickens without permits, and they got rid of those. We talked all about the permitting process, and they decided to send them to a farm outside of Bedford.
Okay.
So all of the pool inspections are completed. Everybody has their permit. So there are 6 pool locations, but 13 pools in total, because some places have multiple pools. And although there were 4 animal bites, and that does sound excessive.
Sounds like a lot.
It does sound excessive, but they're all different situations. So there is a location that went to an off-site event with their animals and educated teens and young children not to touch the goat's mouths because, you can get a bite and then the animal will have to go to quarantine. So all of the young kids decided, that we shouldn't do that. We're not gonna do that. That would be bad. So a teenager decided to stick her finger in the goat's mouth. Of course, getting a bite, and then the goat had to be quarantined for 10 days, which is really unfortunate. And
It's a shame for the goat.
it is a shame, but the owner put another goat in with them so that they had a friend. So that was good, because it's not great to be in quarantine alone for 10 days. There was a dog bite, a dog was off leash. This dog was actually a resident of Everett, so.
Just
the owner must
visiting.
have come when visiting, yes. And then there was a dog actually was bitten in another situation. This is from a wild coyote. Another one, the Bedford resident was visiting a friend, and the friend had a cat. This is outside of Bedford. And just was playing with the cat. The cat wanted more rubs, so did a playful bite, but because it broke the skin, they had to go to the doctors. The doctor decided to send us exposure to rabies report. So these are just anomalies that are just, all of these are kind of like thrown together in what's happening this month. And then there was a dog that was bitten by an unknown animal. So one, we knew there was a coyote, and then that 5th one, It's still actually unknown, to be honest with you, if the dog actually was bitten by an animal. The vet seems to think that it's possible it was an animal, and it's also possible it kind of rubbed up against a tree that had fallen in their yard. So,
So who reported that one to you? Was it the owner or was it the vet?
the vet, yeah, we get batches by the vets all the time, yeah. And then 3 quarantines were issued that were necessary.
Wow.
And I'm, one training that I'm excited about is the first of 3 series. It's a very short training, it's just a half hour each time. But it's an overview of AI and its impacts on public health. So the first session was really just an introduction to AI and what people's comfort level is with AI. Because a lot of people are very leery about it still, not trusting. And the fact is that regardless of your of how you feel, it's moving forward at a fast pace. So it's sort of like, let's figure out how to get everyone on board to embrace it, but understand that it's not foolproof just because it provides information. That's a nice way to save some time, but then you have to go through and make sure that that's
Have
accurate.
references, yes.
Yeah.
Digital, yeah.
And
Yeah.
it's also interesting, just going on the AI for a second, if you put in a browser, like you're searching a particular topic, if you put that topic and you say minus AI, you'll get non-AI answers.
Really?
Really?
So that works in the browser, so
Okay.
you can see the AI
Yep.
and you can also see without.
That's interesting.
And anything you put in the search engine for AI can never be deleted, and that's good to know.
Yeah.
Anything you search is forever out there associated with you.
That's right, if you're a company
Wow.
that gets
Yes.
special
Yeah.
enterprise licenses and such.
So any questions?
Yes, I actually have a question, I remember vaguely that you are offering at least annual training for, food establishments, right?
That we're doing that, yeah, so that's still in the works as far as just getting the education piece together, and then, we're talking about who would be available to provide that education. We have a couple of people in mind, and it's really just gonna come down to scheduling, because we want it, the
Right.
most important thing is that it gets done in a timely fashion.
Yeah,
And we still have time, so right now we're in the early phases, but the food code is the food code. And we would only have trusted people that we've already worked with, so we're not really too worried about how this would roll out.
mhm.
And I'm sorry, I wanted to give another update on, the special meeting and hearing that we had on May 7th.
Yes.
Right,
Yes.
yes.
Yeah, the resident at the address 30 Selfridge Road, they did meet all of the conditions that were ordered that day.
Oh, that's
Oh,
lovely to
wow.
hear.
Very
That's-
excited.
Great.
Yeah, he did a good job,
That is really,
really good job.
Great.
And thank you to him, but also thank you
Yes.
for
Yeah.
working with us so we best understood what was needed to help move the situation forward.
Yeah.
So
Thanks for your
you.
support, that really helped.
Yeah.
Any questions on the two of you?
Nope.
Thank you.
Question for you on the food establishments, and the inspection.
Yep.
Anything that you think is getting worse with any of these that we should keep our eye on, or is, like,
You mean particular food establishments or
Yeah.
just the type of
the
violation?
type, like, some of it just seems like education, and I
Yeah.
appreciate what Dee was saying.
Yeah,
But I'm just wondering if there
Yeah.
are any establishments that should be, like, monitored more right now.
oh, I mean, so they're asking about like their particular food establishments. I mean, yeah, I have one.
You have some
I
that
guess
you're
the
working,
question
more
is,
than a half
is
in
there
mind.
one that you're concerned about? or you're
yeah, is there
thinking
anything
next
you're really
Yeah,
concerned
first one
about?
I'm bordering being concerned about.
Okay.
Okay.
So,
Just keep us posted,
yeah.
because, we've got your back, like,
Thank
we
you.
wanna make sure that the community is safe.
Yeah. And we're gonna be rolling out procedures and, so that the food establishments really understand this is the protocol. If you have, certain number of violations, certain type of violations, it will automatically prompt, an administrative meeting with me. And then from
Oh,
there,
Great.
yeah, wait, this is how we did it with, with bamboo. It
Right.
just wasn't an official thing. I would always tell them up front, this is
Right.
what's gonna happen. These are the steps that you can take to prevent that.
Right,
And then when steps weren't prevented, I felt like at least we told them what would happen and that
Right.
they just didn't do it. So this is just gonna be a little more official.
Okay.
nice,
Yeah. He will be informing all of the food establishments about this.
No, great,
right,
no, thank you.
right.
Heidi or Jackie or Danielle, anything?
No, it's Heidi. I just wanted to give Marisa kudos that her work on the partial condemnation case was smash up. Like just did a great job on that. And working with the resident, and obviously I know the board and all staff really felt, and our social service team felt great with the fact that that individual was able to stay in his home. So just
Yeah,
Yes.
great.
Thank
Yeah,
you,
thank
Heidi.
you.
Thanks
And
for
it
your help
goes
as
back
well.
to you really, you worked with them and then gave us something that would work.
Thank you. Heidi was a great mentor for that as well.
Thank you. Jackie, you wanna go next?
Sure. Hi, everyone. Hi.
Hi, Jackie.
So for number 2, the summer camp process continues, summer camp permitting process, I should say. So applications have been received for 8 camps. Summer Quest is an addition. They have not been here since I've been here, but it's only 2 years, so, but they seem very good to work with. Currently reviewing documentation and developing an inspection plan for all of the camps. Some of them don't start till August, so it'll be throughout the summer, but about half start at the end of June. Number 6, attended Hanscom Air Force Base's Health and Fitness Fair with Chris Bang from Youth and Family Services and Rachel Berg from the Rec Department. We staffed 2 tables with Health and Human Services Department outreach and supplies at no cost, like Narcan and personal hygiene products. I should have brought more Narcan because all of it went pretty quickly. Got quite a few questions about how to use it, when to use it. I was able to offer education and resources for if they would like to look into more, like reliable resources to look into. If they wanted more information, had sheets I was giving out, and got some good questions about if there's going to be any Narcan training. And I know that's something I've been talking about with Olivia. So it kind of like sparked that idea again. And we have a meeting with Olivia tomorrow, so I was going to mention that. We've gotten some questions about that. And it's just nice going to the health and fitness fair because there's a lot of people, it seems, or many people who I spoke to who were there who live on base didn't realize that they can utilize Bedford's resources. Like they can use the rec department, they can come to the health department. So I first went last year and then this year, and it's been nice. So at least people know that they can use Bedford's resources, and especially with swim lessons. Quite a few questions about swim lessons, and we were able to say that Springsford Park offers swim lessons and also other places people can go. So it was very successful. We really enjoy going there. Let me see. What did I want?
Can I just ask you, is that the
last
first
year we
time you
went to.
or?
No.
Yeah, okay. Okay. so
Last year was the
the
first year, yes.
maybe?
And thinking for next year we'll get 2 tables. I only did 1 for Health and Human Services, but next year we'll probably do 2 or 3 or have each department apply because it's actually a really good way to do outreach. I attended the monthly MAPFIN meeting, so the Massachusetts Association for Public Health Nurse meeting at the Public Health Museum in Tewksbury, which was really nice. It has a really good tour there. If anyone is looking to do a nice informational tour, was really good. Posted an unhealthy heat alert and coordinated a 3-day cooling center with CERT support. It's always great to work with CERT. I think we partner really well together. And as Susan mentioned, how it was nice that she could probably speak to it better, but when she was staffing the cooling center, she noticed that some people walked by and because we put signs out, they're like, oh, it's really nice that Bedford offers a place with air conditioning for people to go. So even just having the sign out there and offering it kind of spreads the word, which is nice. Especially because it's gonna be a hot summer.
Mhm.
So we didn't
Did
end
you
up
have
having
any
any
takers?
takers. I think one of the days it was pretty nice out, so it wasn't even really that hot. Trying to get down exactly what's going to qualify as a cooling center. Massachusetts last year made an unhealthy heat alert, but that's if it's just based on whether or not humidity or anything. So it's if there's 3 days of 85-degree weather or more, it's an unhealthy heat alert. But sometimes it's really nice 85-degree weather and it's like really nice outside and you might not even need air conditioning. So I think it's just going to take some tweaking to figure out what exactly qualifies. But I think it's better to have it than not anyway. So even if we do err on the side of caution, I think it's worth it, even if, especially because I think it's just gonna get more humid as the summer goes on. So
And if I can just talk from a CERT perspective as well, you know, like by having it in the town center, it worked out well because CERT covered a lot of the shifts, but we couldn't cover them all. So it's right next to where the health department is. So if anyone did come, we have a sign that said, please check in there. And the idea is really just to give a cool space where people can bring pets on leash or in cages where you can't bring them to a lot of other places. You can bring comfort animals, but not pets. And as Jackie said, when I was staffing it, there were multiple groups that had been participating in a rec program, but then walked by and saw it and just like, ooh, I don't need it now, but it's nice to know that the town is offering it. And, you know, like it's all about getting that message out. We've talked about that a lot.
Yeah.
You know, like, and it was published on Facebook and also in the Citizen, but just having people walk by helps.
I was wondering, do we have anything where like there could be using the town robocalls if we have extreme heat kind of thing to announce that the cooling centers are open?
Yeah, the reverse
I think
911.
we mentioned that last year, and Susie, you could correct, but they
Yeah.
wanted to keep that for like emergencies. But but it was a good idea. And I think we did bring it up last year, but
Well, I don't know. I guess, you know, we get the call about road closures for, you know, pole
Yes,
capping and
yes.
things, and I'm like, that's not really an emergency
Right.
either, so I guess I didn't know if there's like a different level of service.
Yeah.
But, okay.
But I think it's something, you know, like, Jackie, we can look at again, in the future, especially if it's really bad.
That's the thing, yeah.
You know, like, if it's really bad, then it's a public health emergency, and then
Yeah.
I think there's something. But like this past time that we had it, wouldn't warrant it, and we don't want to
Overuse it,
Yeah.
yeah.
overuse, you know, code red.
Yes,
type of
that's
thing.
what it is.
and then Greta Stanier, our health department intern, has started her internship. She's really great and she's off to a great start. Her main project is working to bring health presentations to Ashby Place. She's creating, disseminating, and analyzing a survey to administer to Ashby Place residents about what health-related topics they'd like to see, because I didn't want to show up with things and no one's interested in it. So we wanted to survey and see what the people there would be interested in learning about, or even just to offer like a social hour. So like people have health-related questions, they can just come talk. And then Youth and Family Services, Chris Bang is also is joining in, and then Kathleen, the Council on Aging social worker, is also interested. So all of us are going to work together to kind of access Ashby Place, because I think it's a population that we haven't that I think can be better served, and I think we're on the right track to doing so. And then she's also going to
Great.
promote our website and Facebook to try to get more followers and
Right.
people looking at the website.
Yay. Great.
No, that's great, thank you.
The table,
And
sorry.
Question, sorry. Yep.
Yes. Disease, yeah, hepatitis.
We did have 3 Campy cases, but they were not related to each other. So just 3 separate, but this is or Campylobacteriosis, sorry, cases. It's going to be more common, so 3 throughout the town is not concerning, and it was wasn't from the same place or anything. So I'm anticipating that we'll end up with more foodborne illnesses as the summer goes on, just with cookouts and eating out and more socialization. And then there wasn't anything else that really stood out to me unless there was anything anyone had any questions on.
Also hepatitis B.
Yeah, we don't have to investigate hepatitis B. It's just I get notified of lots of reportable diseases, but not all of them we have to investigate, and we usually have like a couple a month. But there's not. I don't have to follow up on that.
Great. Any questions about Jackie's report? No?
The one I had about camping.
Yeah.
Oh, sorry.
So I said, you answered the one
Oh,
I had
okay.
about the Campbell.
Right,
right.
Just-
Yeah, I thought that was
Yeah.
so, but yeah, that's good.
Marisa, anything? No questions? Danielle, Heidi?
Just
anything
that,
for Jackie?
bringing on another essentially a summer employee is a huge task. Jackie's gone through and it's actually an arduous task that DPH requires that we go through, and she's done a really great job participating and being really thoughtful to meeting Greta, our intern's needs, but also at the same time meeting some needs that we've had within the department. So I think we're going to end up with some really great outcomes come August with regard to all the great work that's going to be done this summer. So kudos to Jackie on that one. No, I'll leave it at that. I think that was, it's really great. Thank you so much, Jackie.
Oh, thanks, Heidi.
Yeah, and I had an opportunity to meet Greta the other day, and I agree, she's a force multiplier to help you guys focus on other things, but make sure these projects move forward. So thank you.
Yeah.
Heidi, you want to give your
Certainly,
report?
yeah, thanks. Hi, everyone. Thanks for accommodating my remote status tonight. I am a little under the weather, so appreciating being able to participate, but and be able to contribute to tonight's meeting. So from my report, we did do starting to really pick up this issue that's kind of waxed and waned over the past several years, sort of during COVID, but even before COVID, relative to item number 5 on my report about safety improvements within not just the health department, but now, sort of all of our town center offices. And met with the assistant town manager, Amy Fidalgo. We did a review of some areas and some offices within the building, trying to figure out how to make our staff feel safe. There had been some sort of past aggressions over, going back many, many years, not just in our building, but as we know from the news, many communities have kind of struggled with this. But our building is a lovely building. It's an old schoolhouse that has been added onto, and it's just not, the perfect municipal space. So we're trying to just work with what we've got and work with our town manager's office and facilities department to make our staff have a little bit more support and feel safe. So more to come on that, but I think we have a good plan in place that can be accommodated within our existing budget. No additional funds needed. So that was also a good thing. So the Board of Health, the health department has for years managed an automatic electronic defibrillator program within the community and public buildings and public spaces. And I think, Jackie, correct me if I'm wrong, we're up to 20 units that we manage. Is it, or Danielle, maybe one of you know, is it 16 or 20? We added the nurses.
It's 20.
It's 20.
That's a lot.
Yeah, it's a lot. So, initially, actually, town staff, meaning me, was going around, changing out batteries, changing out pads. It became arduous. We were able to greatly, in the early days, build it into having a contractor do that for us. So, and as a result of that, been able to have a budget that enables the AEDs to be replaced in an appropriate time frame, as well as being maintained on a regular basis. So we started to think, given the Board of Health's desire to kind of take a look at more intergenerational, recreational kind of gathering spaces, also kind of realizing our fields and recreation spaces some of them are kind of pretty remote, that it might be a really good idea to have some AED units in those more remote areas and in some of those fields. So Jackie did some background research, and we pulled together a meeting with Josh Smith from the Recreation Department, Fire, DPW, and Facilities to talk about what should we be doing here. So we're building a plan. We're building a sort of prioritization plan, And we're gonna put together what probably looks like a more formal capital budget approach to this, as opposed to sort of phasing them in. Let's go kind of like with a bigger project, get them where we really feel we need them right now. And then they can be either solar powered, there could be some Wi-Fi ability to be able to connect to 911. So stay tuned for more on that. But that's a really exciting program that actually was spurred by a student from Bedford High School that wanted to, put an AED at one of the recreation fields. So she's raised some money. We're going to keep that in an account and use that to purchase our very first AED once we come up with our prioritization plan. So great, really great collaborative effort there that will ultimately be spearheaded by recreation, simply because all of the locations are sort of managed by the recreation department. I did some work with Susan and Liz Torres Rios from CERT to develop and build the convert the CERT page over to the health department. It's just a little bit more manageable that way. Because I have a lot more regular interaction with the CERT team, so it's easier for me to manage that page. It was originally managed by Fire, who did a great job, but again, just it's more about just the level of collaboration. It just made sense for it to be with us, and then we're able to build the new. And I'm sure Susan will talk about the community preparedness binder, but we built a new website based off of that. We love the style of the website, so we're going to convert some of the other Board of Health goals. Sites, for instance, the Bedford Safe, the gun violence prevention site, to a similar format. So tightening things up on that end. We have our Veterans Veteran Services Officer, retired Bill Linehan, had been with us for many moons and served the community well. So I've been working with Karen Tyler, the Veterans District Director, to review resumes, and we have some interviews set up for that position in the coming weeks. So that'll be exciting to have a new face in that position within the Bedford community. Another thing we talked about last time was, this my consideration and kind of interest in human trafficking and what's going on in Bedford relative to that and around the community. And so at one of my meetings, I was talking with a friend colleague. Actually, we went to middle school together, and we coincidentally actually still work in the same field. So we were reconnecting, and she suggested I reach out to the Wakefield health director, who actually is a health director who sits on the Mass State Massage Board, which you may know, we've talked about this before, like going back even before my time in public health. So this is going back, over 20 years. 20 years ago, the local boards of health departments managed and permitted massage therapy establishments. The state took it away. It'd be interesting to look at the legislation as to why or the reason as to why that happened, which actually Cheryl might be able to speak to. But anyway, so Anthony has a seat as a local health director on this board. He's interested in the connections as to potentially like how locals can be more involved in that, because I think for 351 communities, there's only 5 massage therapy establishment inspectors across the state. So that doesn't really jibe with the potential number of establishments that exist that are even licensed, let alone Body Works, which we've talked about are not advertising as massage, but are actually doing hands-on quote unquote therapy work. So more to come from that. I think it was a good introduction, and I might have an opportunity to have a little bit more involvement with the state board, and then leverage that with some of the services that are offered by some of the supportive organizations that work with folks in the human trafficking realm. So it's fascinating. It's sickening. It's like so many different emotions all at once. But I think there's a little bit of opportunity. There's a lot of opportunity for some advancement there, particularly on the local level. So we had our annual mosquito control collaborative meeting. The one question I had was, is our EEE sort of cycle shortening? The consideration is that it's not really shortening, it's just more sporadic now, and so weather dependent. And with climate change, I think they're kind of revisiting what if there is even a cycle, but instead looking at sort of previous year's weather and the overwinter weather to be a predictor for the model. And just basically, given the weather we had this past winter, overall mosquito populations are expected to be lower than usual, and we're not expected to see a triple E this year. So those fingers crossed. I guess things could change potentially, but I thought that was a good outcome or a message from that meeting. And I'll leave it at that unless anybody has any questions.
Any questions?
Maybe just on 18,
Yeah.
that, our, Board of Health was recognized as for the pre-demolition checklist.
Oh yeah, that was exciting. I was so totally surprised by that. I'm in this, huge room in Marlboro with like 300 health directors, and this team from DEP came up, and they look for they try to, these meetings really strive to kind of look at some niche programs that might be held or operated out of local health departments, but this being a really interesting one that the DEP is very interested in hazardous building materials, like some stuff that you're not necessarily thinking about spills and leaks from like gas stations or chemical plants, but like what's in our everyday environment. So there's always been a desire by DEP, Department of Environmental Protection, to have a connection with the local health departments relative to asbestos and lead. And then also thinking about mercury, where mercury can be in your environment, because one tablespoon or teaspoon of mercury can contaminate an entire pond the size of Walden Pond to the point that it could never be used again. Like it's remarkable, the stats. I might be off on that, but it's something like that remarkable. Anyway, so years ago, when I was in Burlington, we had a pre-demolition checklist. When I came here, we had a rudimentary one. I expanded it a bit, made it a little bit more interactive, and then we integrated it with every building permit application. So that's what was highlighted. So these folks from DEP had been presenting to the building inspectors, and during that meeting, that's when it came up about our checklist, that we were one of the communities in the very early days that were integrating and connecting with other departments to ensure that anytime some building materials were being moved, renovated, demolished, that there were some checks and balances as to whether or not it was being done correctly and in a safe way for the residents, for the occupants, for the neighbors, and for the workers and the environment. So that was exciting. A bunch of people came up to me afterwards, and I just gave them, I just said, go to our website. All the info was there, and reach out to me if you have any other questions. But it's a great model template for any health department, not even just in Massachusetts, but anywhere to use. So that was fun.
Yeah. Great,
Yeah.
great.
No, and kudos to you for bringing that to Bedford and updating it. But one thing you mentioned in that idea that I just wanted to highlight as well is, when Jackie was talking and Marisa, when you were talking about the collaboration with other departments. And, like in my time on the Board of Health, I just keep on seeing more and more opportunities, and you guys just go for it, which is
So
awesome.
great.
Because it really helps the community, and like Heidi, this is an example of like your experience, and then also working with like the other permitting authorities in town as to what really needs to be captured. So like kudos to the entire team,
Right.
Thank you.
because the only way that it works in Bedford, and I would assume in other communities, is if it's done collectively.
Right, because I mean, I experienced when I moved into my house, it had been built in 1986, I was the second owner. The whole backwoods was full of all construction garbage.
Oh yeah,
And that we had to,
that stuff can.
and then we had to, I mean, nothing was hazard, I mean, there were like old
But you
fence
know,
springs,
yeah.
there was tiles galore. It took us 5 years, my husband hauling stuff out of there. It was the dump for the 3 houses that were there.
Well,
Anyway.
It's also a testament to the model, right? This HHS model, and why it works so well is that it enables us to collaborate more regularly and empowers the staff to know that they can. We broke down the silos. There were way too many silos in the early days. I mean, not that we still don't do our own stuff in our own minds in certain ways, in ways preferred ways, but we meet collaboratively so in so many ways and so frequently that I think it's really it better serves. It sort of checks the box. Our number one line item on our list of job duties is customer service, and I think that's what people have in Bedford deserve. I think it's what they expect, and I think we're meeting that goal. So we're really happy
Yeah,
for the team.
no,
It's
totally.
all about the team, though. The team, we couldn't do it without everybody working together. So to appreciate that comment and allowing me to showcase that. Thank you.
Yeah.
I think the other thing that it does is that, Heidi, you and your team constantly broaden for the community the whole concept of what is public health.
Yes.
You know, so then take it out of just the tick-borne and mosquitoes to see how public health just is so woven into so many parts of the community.
Yeah.
So
Right.
I
And that
appreciate
we'll
that.
get into that more when we go through the goals and
Right.
everything, because we
Oh,
really
yeah.
expanded it. But just one other quick thing, because Heidi alluded to it, and if you haven't checked it out, both in the library and then on the CERT webpage, there is a preparedness guidebook. It was built in collaboration with Health and Human Services, police, fire, and CERT volunteers. And I've now heard from people in other communities who have seen it, because if you Google preparedness and safety, it comes up.
Okay.
And when we sent, from a CERT perspective, sent the announcement out, some people sent it to people in other communities. So
Yay.
live in Bedford, it's great for Bedford residents, but it's also preparedness wherever you are. So, and thank you, Heidi, for your help on that, because it really is something that was a collaborative effort.
Well, Jackie helped me build the page. Build the page. I couldn't have done it without her. She's our little web expert in the office. So it ended up being a nice outcome.
Yeah. Any questions on any of the staff reports before we move on?
No, good, thank you.
Okay, great. Thank you, everyone. And next on the agenda is to talk about tobacco and nicotine and a discussion of pending state legislation and a revised draft of our regulation. I'd like to introduce Cheryl from MAHB and Pari, who is our tobacco inspector. Pari's here with us. And Cheryl, I know you're on Zoom, so welcome to both of you. Heidi, do you want to just kick it off to how we got here?
Sure. So, every tobacco is ever evolving, as we know. Tobacco is now not just tobacco, it's now nicotine, right? And the products that we have are like, they try to be anonymous. They try to, trick us with the language, and there's legislation that's kind of pending around all this stuff. But like, there's some communities have had a really good luck, as you all know, with this tobacco-free generation. Ultimately, I think from a health perspective, going tobacco-free is a huge and a monumental goal and achievement. So if we can do it for our community in advance of the state doing it, or in advance of, or after Britain does it, I mean, come on, like a whole country can do it, but we locally can't do it one-on-one. I just think it's a good conversation. I think we have some, challenges that have happened. The local boards have been challenged by big tobacco, and we've been supported in the courts. So I think for a lot of, what we're proposing here is has been done in advance of Bedford, and should be able to be, held true. And I think this board has always been interested in promoting this particular topic and cessation of tobacco use in our community. So this is the regulation that you have before you tonight, and we can dive into it a little bit more with Pari and Cheryl and Marisa. Thank you.
Yep, thank you, Marisa, and thank you. So Cheryl and Pari, I don't know if one of you wants to kick it off.
Sure. Do you want me to just give sort of an update of where we are in the state on this?
Yeah, that would be great.
Yeah,
Thank you.
We have, and Pari, correct me, I may have missed some of the municipalities. Let me first explain what the policy is. And the policy is referred to as the nicotine-free generation. It would address all oral nicotine pouches, electronic vaping products, and tobacco products. And we have seen a pretty significant uptick from 1% use in high schools to a 3.2% use of oral nicotine pouches. So that's it doesn't sound like a lot, but it's more than double, it's tripled in a short amount of time. And we're hearing from a lot of schools a real concern for the way these products are being used. They're pretty unassuming, they don't have a smell, they don't have a taste. Well, that's not true. They don't have a smell that a teacher can recognize. The vast majority of these are flavored pouches. And while they have a certain amount of nicotine in them, you can put more than one in your mouth and it will dissolve. So the theory behind the regulation is that you would ban the sale of these products to anyone who is under the age of 21 on the date the regulation goes into effect. So whenever you set your effective date, anyone who is not 21 would never be able to be sold a tobacco product or a nicotine product in the town of Bedford. Anyone who, and see, I'm trying to describe this as cleanly as I can, Pari, because it sometimes does get confusing. Anyone who
Yeah, you're
is
doing well.
Okay, good. Anyone who is 21 on the date that the regulation is effective would always be able to be sold tobacco. Again, it's not a possession law, it's a sales law. Stores could not sell to anyone who is not 21 as of that date. We have right now, I think it's about 25 municipalities that have enacted this regulation. It's relatively new. I mean, it's been around, what now, for maybe 3 or 4 years, something along those lines. The UK did adopt it on a nationwide basis. It's not just England, it's England, Scotland, Wales, Northern Ireland, and one other country that it's escaping me right now. So we have a draft, and I'm sure Pari has it for you, which would give you the language that you could adopt this policy with. It's currently being, we're looking at the health effects of this policy. As you all well know, in public health, our regulations frequently are passed quicker than we have the actual science behind. That happened with environmental tobacco smoke, secondhand smoke. It takes a while to get to those positive, impactful outcomes. However, that's how it always is in tobacco control. Always. Our gut tells us we know this is right, and it's part of a comprehensive approach to nicotine and tobacco. As a result of the activity, well, what really happened was when Brookline passed it way back when, they were sued by the industry. It went to the Supreme Judicial Court, and the court upheld it as a reasonable, in Brookline, they did it as a bylaw and as a reasonable public health regulation, that the state law that increased the age to 21 did not prohibit cities and towns from going further than that. There's a question about whether it is actually going further than that or not, because it's not prohibiting the possession, it's only prohibiting the sale. When the court ruled that way, it gave everyone a green light to pursue the policy, and municipalities started pursuing it. We have the policy in Western Mass, in Metro West. I don't think we have it yet on the Cape. Yarmouth is talking about it. So that's where we are statewide. I don't remember the population, Perry, do you, that are covered by it? I can find out, but the
No.
interesting thing is that there are cities. Medford has passed it, Chelsea has passed it, Malden has passed it. So we're not just looking at, the regular first adopters, which are normally, the Winchesters and the Bedfords, and we're looking at urban areas that have passed this policy. There was legislation pending in our legislature. There were two bills filed, one in the House and one in the Senate, to enact this on a statewide basis. It was a little strange, in my opinion, that it happened so quickly, because these kinds of bills normally take a few legislative sessions before they have, in quote, legs, where you have enough municipalities that have enacted a local law that the legislature feels comfortable in adopting a statewide law. And they were both sent to study, which means they were effectively killed. The first one was the House bill, which was sent to study in December of 2025. And then the House bill was sent to study in March of 26. Heidi mentioned two other bills that are pending. And these bills are much broader than tobacco. They address more issues than tobacco. They would effectively preempt local boards of health from regulating any adult use product. This is a very broad preemption bill, to both bills. The House bill was reported out favorably and is now in the third reading of the House. And the Senate bill was reported out favorably and is currently in the Joint Committee of Consumer Protection. They both had hearings. We obviously don't know. They're not dead at all. They're still alive. MAHB and the Coalition for Local Public Health are extremely concerned about these bills. And again, they're not only about tobacco. They're about FanDuel has testified in support of this, in addition to the tobacco industry. And this is not the way we conduct our government in Massachusetts. We have the Home Rule Amendment to the Constitution from 1966, which clearly limits the state's authority to address these issues and puts it back to the municipalities. And we have Chapter 111, which none of our public health laws are preemptive. We do have a court decision on a pesticides case, but that was a unique situation. We have one of the oldest and most durable public health frameworks. The origins go back to Paul Revere's chairmanship of the first Board of Health in the United States. It's really the fabric of how we work as a state, as the Commonwealth. So we have sent letters to both the House and the Senate and the committee that has these bills before them. We have spoken with many legislators who weren't even aware that this was a bill that had been filed. They have stated in no uncertain terms that They are not in support of this. These kinds of preemption bills have been filed in the past, and they have all been sent to study. We are cautiously optimistic that these two bills will also eventually be sent to study, but we can't, we can't guarantee that. We have to, I looked at InstaTrack while I was waiting, and there's still one's in third reading. And the other has not come up in the Senate in the full session. So that's what's going on with this right now. Pari, do you want to go through a little bit of the regulation, or did I?
Yeah, sure.
Oh, before you go through the regulation,
Yeah.
it's okay, not specific to the regulation, but I just want to ask the other Board of Health members, any questions about what the objective would be? And, about what, like Cheryl framed and Heidi framed and Pari's gonna talk about is just, like, at this point, we're not taking a vote today, it's more of a discussion. Is
Yeah.
this something we wanna do? And if it is, then go, the regulation would be the way to do it, regardless of what the state does at this point.
Right.
Because we can move quicker.
Right, okay.
So any questions before?
No, that's good too.
No, it's
Okay. Except for one thing is Pari, either you or Marisa had a handout
Yeah, we can
about
send
this.
a copy of this.
If,
copy.
if it could
Yes.
just be disseminated to all of us, that would
Yeah,
be
that'd be
awesome.
really good.
Yes.
Thank you.
Last minute in case you have
Yeah.
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 No, thank
This
you.
is given by the MTCPTAs to circulate among the Board of Health and other communities. Just
Okay,
to give an introduction to energy policy.
okay, great, thank you.
Yeah.
So with that, if you wanna just
Sure.
like add to what Cheryl went through
Yeah.
and then talk also about the
Sure.
draft.
Thank you, Cheryl. Good evening.
Thank you, Pari.
Good evening, thank you for having me. I'm here just to go through what is the update on our new regulation. So I would start with the overview of MTCP objectives. MTCP is coming under Massachusetts Department of Public Health, Massachusetts Tobacco Cessation and Prevention Program. So I am coming under the MTCP Board of Health program. Basically, the scope of objective of MTCP is to prevent young population and youth and young adult population, prevent them smoking and vaping, and quit smoking among those groups of population, and not only in that population, focusly about youth and young adult. And third one is addressing the secondhand smoking and vaping population,
Right.
with considering their equity and diversity and other policies. So when coming to MTCP Board of Health program, whereas my scope of work is to work with the Board of Health and community partners to suggest new policy adoptions, which will serve the objectives of MTCP. So that is where I am here, and MHOA is one of the MTCP TA, and they provide us yearly model regulations based on available new policies which are adopted in the communities in Massachusetts. So as far as concerned, our current regulation is not too old. We have adopted in June 2023.
Alright.
So I know it is 3 years now. It's not.
Right.
It's.
It's not ancient.
I have seen communities having it since 2018 and all, but ours is still new. But ours is still not covering to address flavored products like vape products or nicotine pouches, which are available in the community. So we may have to adopt the current model regulation, which is given by the MTCPTAs, which includes adoption of like the statement of the purpose of the statement. I mean, the whole why we are having the regulation, and then few definitions, which includes manufacturer's document. Manufacturer's document is basically when we go for inspection, they need to have the manufacturer's document for all tobacco products like nicotine pouches, cigars, cigarettes. If they don't have the manufacturer's document, we are allowed to remove the products or advise them to get it out of the store. And if they provide us the manufacturer's document, then the protocol allows me to keep the product in the store. But now what is happening is the manufacturer's document is misleading the product. Because if they're having a vape product, tray or any product, if I open and smell it, it is flavored. but the manufacturer's document claims that it is not having a characteristic flavor. So most of, I work for 16 communities in Metro West, and most Board of Health has gone for flavor testing and decided on flavors. So this is like never ending story because new products are coming here, removing few products. So now the recent guidance document from TAs are allowing us to go for FDA authorized products, which comes down to a smaller list.
Right.
So we're in a place where to update our regulation to include all these definitions and wording so that when we go for inspection and implement these policies, we can get rid of all these flavored products as per the state regulation. That is where we are now. So, and also we have adopted, and suggested to adopt the capping policy in Bedford. Currently, we have 6 tobacco permits.
Right.
We don't have a cap, so it is a suggestion for going for a reducing cap, which allows Board of Health to have only 6, and then it is not growing going forward. And
Yeah,
other
so
than that,
one quick thing on
Yeah,
that, I
yes,
just want to
please.
make sure
Yeah.
everyone understands it.
Mhm.
We currently have 6.
Yeah.
And the way I read the proposed is if permittee A says they're not gonna renew
Mhm.
their permit, just disappears, so
Yeah.
now we're down to 5.
Yes,
So
that is a reducing cap. So
the
Can't be
whole,
transferred.
it cannot be transferred,
But
except for if they
can be transferred if they buy.
by
those.
the establishment, so yes, that's right.
as per the regulation, tobacco permits are not transferable. If someone is selling the business with the tobacco permit, then someone else can purchase the permit, the business with the permit, but still the permit comes to the Board of Health. and
Right,
goes
it's
back.
not
They
transferable.
have to reapply.
Right.
Yeah.
Okay, we
I just wanted to make sure that everyone
Yes,
understood,
yeah.
we have 6 now, but if permittee A doesn't
For
do anything with
example-
it, then we're down to 5,
Yeah.
et cetera.
If one of the
Okay.
business decides, I'm not getting more revenue out of this, I'm not going to sell
Right.
tobacco anymore. And then they are not going to renew, within 30 days, they make the permit retires at Board of Health and it comes to 5.
Right,
That's how it goes.
yeah, okay,
Yeah,
That's
thank you,
good.
thank you for that. And
Can I
Yeah, we have-
interrupt for a second? Can I ask a question?
Yeah.
So,
definitely.
how does, Pari, talk to us a little bit about how that, the tolling impacts the proposed changes to distancing? Because if we have, an establishment that is not gonna renew, or is going to, so if we're saying that if you're going to sell within 30 days, you're going to
Yeah.
allow it to be accommodated under the existing, the existing distancing period.
yes,
The existing permitting conditions will be in place. Does the regulation accommodate that? I wonder.
yes,
What-
they do.
the-
Because,
How do we establish that that trumps the new, distancing, regulation?
this new distancing, we are just keeping in place, but as of now, 6 permits, what we have in Bedford will be in the same place. If in case one of the permit, for example, in Main Street, most of them are in Main Street, they want to go away from the Main Street to some other place, considering density, retail density permit thing,
Dens-
yeah.
Density would affect new permits.
So, okay,
So,
good point.
so anyone who's there
So
now,
I think, yeah,
but so if a store exists now and a retail and someone wants to buy it,
Yeah,
mhm.
they can buy it where it is now, but they
Yeah.
could not move it to a
Okay.
place
I think we
that
have
was
added
within
that.
500
Yeah,
feet.
and in here it talked to you that you
Yeah.
can't move.
And yeah, in the new adopted new regulation, we have added in a language where the permits are there in this applied permit in the same address, cannot be moved from that address.
Right.
Right.
So, yeah,
Yeah.
if that is the case, Heidi, the 2,000 feet away from any institution or education institution or healthcare institution will not be in effect unless and until there is there is not going to be any new.
Right,
So,
and there aren't gonna be no,
Yeah.
And there aren't gonna be, I wonder why it was still in there. Why it's
Yeah,
being
I
kept in there.
agree with that, it can be 500 if you
Yeah.
want, so.
and
Is that
so,
okay, Heidi? Did I answer the question?
yeah, Heidi, is that address it?
Yeah, I just wanted to make sure of that, you know, I wanted to know what trumped what and that we couldn't move it. I don't know, I didn't get that from the regulation, so I just want to make sure that's built in.
Okay,
It is.
yeah,
Fantastic.
And
thank you.
anything thematically different before we go page by page, because I'm assuming everyone's got some questions,
Yeah.
but any other
The other
major themes?
major thing in this is after Cheryl discussed about energy, one particular thing what we've added is oral nicotine pouch definition, and we are prohibiting the sale of, as suggested for the prohibition of sale of nicotine pouches. We're not going for prohibition, but restricting to the sale of nicotine pouches in adult 20 store, but Bedford has no adult 20 store. The reason why the suggestion is provided is because, number one, non-combustible nicotine and non-combustible tobacco products, including nicotine pouches, doesn't have any sales tax or a state tax. And number two is last 16 months, I would say 16 months. Before that, there were only 2 products of nicotine pouches. And now there is like different colors. If you go there, you can select which color you want. And most of them are flavored. And I would also like to share this data. In September 2024, CDC published the data on nicotine pouch sale in Massachusetts. Since 2020 June onwards, Massachusetts went for the prohibition of flavored products sale. But if you see the data, it shows since then there is 200% increase of sale in flavored nicotine pouch in Massachusetts.
Right.
Wow.
So, and there is no sales tax, so,
Right.
but there is a bill, Cheryl knows, so I don't know when that will become a law, but as of now, this is the status of nicotine pouches. Having said that, we get more information or from the Substance Use Prevention Coalitions and school nurses and other groups, not only, across Metro West Collaborative, that most of these nicotine pouches are being used by athletes and sportsmen in school, middle and high school. That is the situation of that. And I should also add to this that 5 communities like in Metro West, in our collaborative, Westboro has banned the nicotine pouch entirely, including adult only stores. Hopkinton, Southborough, Natick has prohibited the sale of nicotine pouches to adult only store, wherein Hopkinton and Southborough are not having adult only stores. And then Concord and Norfolk has prohibited the sale of nicotine pouches, all flavored nicotine pouches. They allow only the Zyn Smooth. So that is where we are. So we are suggesting the board to restrict the sale of nicotine pouches.
Right. Okay, and like one thing that you just mentioned when you went through the different towns is, and we're gonna go through the regulation, but as a board, when you're thinking about, we can do all of this, we can do some of it, we have to figure out what our
We have to
stance is gonna
prioritize
be.
it, yeah.
And it could be everything.
Yeah.
It could be some of it, it could be none of it.
Okay.
Like, but that's why I wanted to know the themes of the
Yeah.
changes, so thank you for that.
And yeah, another one thing is, I think Bedford has the wording that regulation has the wording that the permit holders from Board of Health, tobacco permit holders should follow federal, state and local regulation when they are applying for a permit. So, and here we have incorporated in section 17. It was incorporation of state law was there, state and local. We have added the federal regulation wherein we can enforce on the federally authorized products. That is why we added that language. So these are the suggestions for the application of regulation in Bedford. If you have any questions, please.
Any questions before we just go through it?
No.
Alright. And if we could just I'll start page 1, I don't have anything. But, and I didn't have anything for a while. What's the first page anyone has?
Well, I guess page 7, or am I jumping too much?
Hold on, let me get there.
The definitions.
The definitions, yeah, I think that's where to start, because
Yeah.
whereas we get, yeah.
Yeah.
But it's also, it's the definitions and it, you know, unless I'm missing something, we just wanna go through where it's track changes.
Yes,
Right.
that's right.
So the first one is blunt wraps.
Right, so now it's tobacco leaf.
Yeah, so
Added.
we find this flavored hemp wraps, which is not tobacco, but
Okay.
if the flavored hemp wraps are used to
Makes sense.
consume tobacco leaves, then it becomes tobacco flavor enhancer. So to cover that, we updated, we need to update this regulation so that we can enforce on the flavored hemp wraps.
Thanks. It's just good to understand the context of that
Yeah.
one. And then the healthcare institution,
Page 8,
yeah,
okay, yeah, it helps if you just say the pages.
yes.
Yeah. Yeah, that was interesting, I highlighted that as well.
Yeah, it's like, it's weird. Can you explain that one, exempted? So
Oh, there
page,
it is, tiny there,
Yeah.
yeah.
Page 8,
under
Yeah.
17.3.16.
Yeah.
Yeah, why opticians? Like, it's, I didn't get the, why did that come in?
That was a suggestion from the MHOA, like a new model regulation. They are considering all healthcare institutions under the, I mean, like opticians, dentistry, everything under like hospital category. That is why they have added this language recently.
So those people really sell tobacco?
No, it means like these places, they don't sell, but it also includes no one around that place or smoking or vaping. It's a public space.
Oh, okay, this is to define, okay,
Yeah.
that's right, okay.
Except you're saying it exempted, oh, it
right,
may be included, so we can.
Include, yeah.
right.
Okay, I
Yeah.
get that.
So they have
Yeah,
included
so you
the,
wanna add it to,
yeah,
yeah.
dentistry or optometry, everything under the healthcare services.
Yeah.
Before it was not there.
What a healthcare institution is.
Yeah.
Okay,
Okay,
And then page 9, you talked about it, but it's all about the manufacturer documentation. So
Yeah.
thank you for explaining that.
I can show you some products also on that. So these products, if you see like, these are the vape products in Bedford, like, these are all flavored, but if I check their manufacturer's document, it claims they don't have any characteristic flavor.
Yeah. I think,
That is why we need to update the definition.
so what happens with them, if you have a manufacturer that's denying that there's a flavor,
Right.
but there is? Federally, are they being going,
That is where we are adding the federal incorporation of federal state regulations.
okay, so the
When-
federal they
Yeah.
can be charged under federal laws, yeah.
When we have those wordings on our local regulation, and
Yeah.
as an inspector, I'm going to implement our local regulation, then the permit holders can sell only federally authorized products in the market. It allows me to remove the products which it doesn't have a marketing order for any products. So it allows them to sell only 4-way products, like Joel, Views, or Logic, not these products which are not approved by FDA.
right, that's good.
Because the permit holders agree to follow federal, state,
State
and
and
local
local,
regulations.
okay. So the whole idea about a board having to conduct a smell taste test, okay, so.
If we have those wordings, we can bypass the sniff test, or
Right.
I don't want to give board of Health more work on
Mhm.
smelling the product.
Well, and it's subjective too.
Right,
And
Yeah.
since COVID, people have lost their sense of smell, so you can't really rely on that 100%.
and people smell things
Right.
differently.
So you're saying don't put that in?
No, it's in
I
there,
would go
but,
along with what Pat Parry's saying.
yeah,
Okay.
but the documentation is the backstop for
Yeah.
that.
We're trying to avoid doing a sniff test.
Yeah.
But I thought Kari was saying that some manufacturers are being deceptive in what they.
Right,
Right.
so this is
So-
helping to us to bypass the sniff, like, for us coming in, well, I don't wanna
No,
overstep,
please.
but that's, it's called a sniff test.
Yeah.
So basically, you know, if Parry suspects that although something might have a manufacturer's letter,
Yes,
yet he decided, I can smell this, or I can tell it's a flavor, then boards that have what's called a sniff test, he would have to bring it in here, physically bring it in here, and people would have to smell it and decide if that in fact is, you know, a flavored product, because it smells like something
Right.
other than tobacco. So he's just talking about how we can bypass that whole sniff situation and
By
just have a
looking at the
regulation
documentation.
that says it has to be FDA approved.
Oh, okay, okay.
Yeah.
Yep. My next comment is on page 11.
Okay.
Is it okay if we go to 11, or you guys have anything on 10?
No, I think the rolling papers, we talked about that, yeah.
Okay,
Yep, yep.
This is the, yeah, it's.
yeah, 17.4.1 and 17.4.2 contradict each other. Because it says no person shall sell or provide a tobacco product to a person born on or after a certain date. And then the next one says on or before, that we need to verify. So my question is, if I am born on the date,
Mhm.
can I buy or can I not? Because in my read of this, it contradicted.
Yeah, on or after, it cannot be before, I believe. There is,
So,
Typo,
so
right?
on
Typo.
17.4.2, it should just say, every purchaser is born before January 1st.
Before the
Yes.
date, whatever, and going back to what Cheryl said,
Yeah.
it's the date we enact it,
yeah,
but, so the on has to go away there.
on
Yes.
or-
Yeah.
it's a typo,
Because-
I'm sorry about that.
I was reading this and I'm like, well,
Yeah.
and I have
I
a
got
sister who was born on January 1st, I'm like, well, what can she do?
And why can we have it in the first one?
In the first one, because it's
Before.
on or after
Yeah.
is okay. It's, the second part is basically
Oh.
saying the people who are born
Yeah.
before that
Yes, yeah,
have to provide ID to
Yes.
prove that.
okay,
It's funny, because if you look at my notes here, I kept on playing with dates, I'm like,
Yes.
honor,
yeah,
so, okay.
all right.
Okay. And another way of avoiding that, depending on when we enact this, is you could just say born after
So we have the same thing on the
Yeah.
next page.
a
then.
year.
Mhm.
You don't even have to put a date, you
No,
can
it's
just put
okay
a
when it's
year.
on
That's
or
right.
after.
Okay, it's on or before, okay, that's the problem, okay.
Yeah.
In Metro West, I think, Hopkinton and Concord has adopted this policy. In 16,
What did you say?
NFG policy.
Oh.
Yeah,
Hopkinton
it's
and
a
Concord.
date as of the policy. Okay. Yeah, so 17.4.2, okay, just get rid of the on or, okay, thank you on that. And then page 12, A. Born on or after January 1st of this year.
No, it depends upon when we are going to.
Okay, because I was like,
You would,
we're selling it to England.
It's just a tentative,
Where was that?
we can.
That is funny. It's
Oh.
on page 12, it should be
Yes, that's
2006. Not 26.
the regulation should have had, and I just found this today. If you're not doing NFG,
it
you
should be
would say shall take
2006.
effect on whatever date you want. But if you're doing NFG, then you would want it to say 2027
27.
for the
Yeah,
effective
okay.
date.
Yeah, and so anyone, yeah,
Yeah.
and so that flows into page 13.
Yeah,
The first one would,
27, yeah. I guess.
Yeah.
Kind of 6.
and also the question of the on,
Mhm.
Well, yeah, so that should just be born before, right?
yeah.
Before, yeah, like on or after, before, okay.
Yeah.
The two populations, make sure you got the right one.
Yeah.
Right.
My next question's on 14, did anyone have anything before that?
Nope.
No. No.
Heidi, did you have anything before 14? Okay.
No, I'm good. I'm
Okay.
good. I'm following along. I'm good. Yep, I'm good. I reviewed this, a couple weeks ago, so I'm good. Yep.
Oh, okay.
Okay, great, thank you.
My edits are in there.
I just, C says a tobacco product sales permit shall not be issued to any new applicant for within 2,000 feet and stuff. Do we need to even say that because we're not issuing new?
That was confusing to me.
Okay.
If we're saying we're not in 1759BA above, then do we need city?
So in other words, if somebody is buying a business and they bought the business and they were they were 600 feet. And now they bought the business and they bought the permit, and now we up it to 2,000.
Well, that was what we discussed earlier, where
Yeah,
they wouldn't be able to move.
So Pari and I had a conversation around this, right? This was the consideration, because I'm like, we're talking about, you want to toll it, you want to keep it at 6 or less if they don't renew.
Yeah,
So I think this is a conversation, but I feel like, I'm sorry, let me just get back to the regulation.
yeah, the 2,000, changing 500 to 2,000 doesn't make any sense, because we don't have any new permit
And
coming.
that's my point.
Yeah.
I don't think we
So,
need
yeah,
to see
that's
it all.
And does new applicant mean brand new, or since if I bought establishment A
Mhm.
and I want to transfer the thing to me, am I considered a new applicant?
Yes, because you have to apply.
So
Good
that,
point. Yeah, good point.
so I don't understand this then.
So it could, what if, like I said, if you're,
No, it doesn't.
No, 'cause we can't
Permits
move.
don't transfer.
No,
all right,
But
so
they would still have
you're
to
six
apply
hundred
for
feet
this.
from the school.
when they find the business, they.
All right,
the
or let's just say
back to
6.
Board of Health, and the new
You sell the
business owner should
business.
apply for the Board of.
The new
that
person
permit.
coming
It
in
becomes new.
now
Well-
has to.
Well,
now
it's
has
a-
to-
Hold on, time out.
Yes.
There are too many conversations and we're on Zoom.
Yeah, that's true. So.
No, I mean, go ahead, B, sorry.
Yeah.
So because this is a new applicant, but the new applicant could be a person buying an existing business's license, and what if that happened to be 600 feet?
Right, anywhere between 500 and 2,000, I don't get that, like how they have to move their business then?
No, they can't move.
Well, then,
It says
so
earlier
what
that
happens,
they can't.
somebody ever transfer, if you are within 600 feet and 2,000 feet, and now it's legal for you to have an establishment, right? And so you wanna sell your business, I come in, I buy the business, all of a sudden, I can't be a new applicant because I am within the now 2,000 feet.
Right, which is why I said get rid of that whole
Yes.
line.
The 2,000.
But where does it say that? Where does it say the new applicant now has to comply by 2,000 feet?
No, they don't, they're not moving.
We have to call it something different. It has to be called a transfer applicant or something like that. Like, we have to use a new term, a different term. A 30-day transfer applicant or something.
Yeah, it has to be a transfer applicant, it can't be a new applicant.
Right,
That's the
that was
problem
very
here.
confusing to me.
That's
what I was
why.
asking.
Yeah.
So if you see 17.5.9
Yeah.
under E, the last one, the valid tobacco sales permit approved by the town of Bedford Board of Health, the given address as provided in the application form shall not be relocated to another address.
I know, but still, you still don't understand, it's a different class of applicant. It's a transfer applicant, it's not a new person.
Yeah,
It's a
so
transfer.
C should say a transfer.
It's still no. No, I know what you're saying, but
I don't get
the
it.
way we do permits, like if a food establishment. This has just happened recently, so just say, there's a food establishment that's already in place, all they wanna do is transfer ownership.
Mhm.
There's no such thing really with the permit system as transferring ownership, it just means that there's no gap between, one owner and another, but the new owner is a new owner.
Right,
So it's the same, I think this is what we're
Yeah,
saying,
they have
right?
to
It's not
apply-
really a transfer.
They
it's a
have
new
to apply for the
applicant.
new business and they have to apply for the new tobacco,
Okay, so that, therefore, that one would be killed, that would be off the table, that permit would be dead.
That's what I thought, but I think part, I was.
No,
going to-
they
have
Ah,
30
okay,
days.
no.
We are capping at six.
Okay, well, where's the word transfer?
No, transfer is not there, we are
They
not.
don't transfer,
because
permits
tobacco
don't
permit is not
transfer. They have to
transferable.
They
reapply.
have to go with a different word.
Okay, so
Tobacco
we're not
permits are not
transferring, so
transferable.
therefore that permit is dead,
If,
null and
No,
void.
if there is a sale of business happening, or
Right.
a person is going out of business and he wants to sell the business with the tobacco permit to another
Yeah.
person.
Right,
So the new business owner is going to apply to Board of Health
right,
to get the business as well as the permit.
that's right,
So technically, it comes back to the permit, tobacco permit comes to Board of Health and again goes back to the new owner. And they are running the same business in a new ownership.
right.
so at that point in time, then, is that a new application and a 2,000 foot change? Now they're suddenly within 2,000 feet.
But that's what Susan told, we are removing the 2,000, we are getting rid of the 2,000.
Yeah, that's why,
Oh, so we're not gonna have 2,000 feet, it's still gonna be.
Now it's gonna be
because
500.
nothing's moving. Nothing can move unless we
Right.
build a new school.
Right,
It
okay.
doesn't matter,
Yeah.
nothing,
Okay, so
Nothing's
you're
gonna
just
move.
striking the 2,000,
exactly.
okay, that's why we were so confused.
I was confused because I
What?
thought if it's considered a new applicant, we were capping it and not. I thought we were getting rid of the permit.
I know,
That's
that's
just
what
if they close it.
I thought it was
I will give you
If,
a scenario.
Yeah.
if they close it, so another way of looking at it, if I buy, Marisa, you have a permit right now, you sell your business to me.
Yeah.
When I buy your business, I'm buying the right to have that permit,
Right,
but now I have to
You
apply
have to
for it.
apply and then we
Right.
have
I have to pass everything, and if I don't, it goes away.
right,
I'll
Yeah.
give you another scenario, a better example. So we are adopting reducing cap, not a sunset cap. Sunset cap goes to 0. So in reducing cap, we are having 7 permits now in Bedford. Consider we are having, 6 permits, consider there are 7 now. For example, we are having 7 in Bedford and capping at 6. So now, the person whoever is the 7th one is telling I'm going to go out of business or sell the business. Now what happens is the business can be sold, but the permit gets retired at Board of Health because we have 6 as cap.
Right.
Okay, that's what I thought we were doing.
Yeah.
And so we're not
No,
doing
It's
a
not,
cap,
there
we're
is a
just
sunset cap.
gonna make them disappear as they're not.
But it's not a sunset in the sense that
It is a reducing cap.
it's a reducing cap, but it's not a sunset in the sense that by X date, we will be
Right.
at zero.
No, no.
Those
Right,
6
that's not a
could,
range,
in
right.
theory, those 6 could exist forever.
Yeah.
yeah,
If they were
Yes.
always being transferred to an
Yes.
an
Yes.
applicant who
Yeah.
met all the conditions.
Yeah.
right,
Yeah, no, that's a good point.
yeah, yeah, okay, all right,
Yeah.
good.
Okay.
Eventually, there won't be anybody old enough to.
Right.
Well, everyone will age out, exactly.
The product will take care of that.
Yeah,
Uh,
I didn't have any other questions.
No, that was the only one that really
That
stuck
was
with me.
so weird,
I couldn't get that.
I don't get it at
I'm
all,
glad we had that conversation. I
Yeah,
think we all had a different understanding.
yes.
just like the sniff test,
Yeah.
we're all
And so I
looking
just
at it
wanted
differently.
to find out, so right now there are 7 other
6.
municipalities,
No.
other municipalities in the state of Massachusetts that have passed this?
25.
25,
Yeah.
but in this material that you passed around, it said 7.
This is the old one, this is came in 2025.
Oh, okay,
January
okay,
2025.
all right, so it's now it's 25.
Yeah.
But it sounds like a statewide thing is really not expected.
Take some more time, I think.
What has been the reaction of the public in these towns?
Yeah,
It's a good question.
I
Public in the
can.
sense, but yeah,
Yes, sir.
yeah.
I can address that to some extent. It depends on the municipality. There was an issue in Manchester by the Sea where the Board of Health enacted the policy, but they really didn't do any outreach to the public before they adopted the regulation. They held a hearing, but they didn't do the sufficient amount of outreach, and I'm not sure that they notified the retailers. And this
Oh.
was a one-off. This is just one town that this happened in, but I
Right.
think it's important that you know this.
Mhm.
So town meeting, citizens submitted a petition to town meeting to to basically void the Board of Health regulation, which they had no legal authority to do. They don't have the authority to void a Board of Health regulation, and their attorneys told them that they could not do that. And the vote ended up being very close as to whether they could just notify the board that they weren't happy. I think there was about a 10 or a 20 vote difference. So that was that was a very negative reaction to NFG. This has not happened anywhere else. And what we've actually found is the retailers find it easier to look for whether someone was 21 before, after a certain date, or before a certain date. I'm getting confused now too.
Yes.
But it's much easier to look for one date than it is to look for all of the
Becomes
different
rolling.
dates
Yes.
that they have.
Definitely.
So, and again, this is a generational approach. This is a long, this is not, does not happen overnight. So it's a long, it's a long process to get to the point where there's no one who'll be able to buy tobacco in a city or town. So we haven't seen, and the fact that we have this passed in, you know, low income urban areas. I look at Chelsea, who was an early adopter, and they have not received any pushback from this. So this is all anecdotal. I mean, this is definitely
Right.
anecdotal information. But at the hearings, we have had a lot of testimony in support of this. We also have had negative. We've had the industry in, you know, vehement opposition to it, but we've had residents that have been in support.
So there's been no surveys or anecdotal whatever that say we passed it in Bedford, but it isn't passed in Lexington, and all of a sudden there's a rise in sales in Lexington.
We haven't, but the EPIs at the Department of Public Health are looking at evaluating this strategy.
Okay.
So they're in the process of doing it. It's so new that it's hard to get public health outcomes right now, but they are in the process of evaluating it as we speak.
Yeah,
All right.
I could see that like with a Chelsea where it's just like, oh, well, we'll just go to Everett, you know? It's like-
But we've seen that in other cases where
Yes.
Concord, as an example, has, you can't buy water. Water bottles
Water
in
bottle,
Concord,
single, yeah.
single water bottles, but you can in Bedford, and when they're, you know, like the temperature goes up, sales here go up.
Yeah.
You know, so there's gonna be some of that.
Right.
Yeah, and I've seen that also on children's games. If you can't buy
Yes.
water in a plastic bottle, some folks will go to another town to buy it, but that's
I saw a recent article in the Globe about something about FDA and flavored tobacco that
Vaping
they are.
products.
Yeah.
Yeah,
So what's-
President Trump changed, he didn't inform the FDA's tobacco department before he did it, but he changed his belief in whether flavored vaping products were,
Right, vapes.
yeah, and they were electronic cigarette products were a harm reduction tool
Right.
and on, and he's always said that they weren't, and he's changed his mind.
Okay.
And it was two
That's-
products, but it doesn't change
only
the
up to
fact that
him.
in Massachusetts, we ban them all.
Yeah,
It doesn't matter what he thinks.
They're done, right? I mean.
They're done, they're gone.
Yeah.
Yeah.
Okay, good.
Page
Sorry, go ahead.
16, just, I do have a question. So the prohibition of sale of nicotine pouches, oral nicotine pouches restricted to adult-only retail tobacco stores. You said we don't have any in Bedford,
No,
so do we?
we are also restricting prohibiting any adult only retail tobacco store also in Bedford. So we're adding in that language as well.
Sorry, what was that one? That,
Number one is we are restricting the sale of oral nicotine pouches to adult only stores.
yeah,
And again, we are adding another language in the definition of, we are prohibiting having adult only stores in Bedford.
Right.
right, so I
But
guess
right now, we
that's,
currently don't have any, but we're
We
gonna.
could.
that's why I
prohibit
guess,
them.
I don't know, part of me just goes, why do we need to have, say,
Yes.
it's restricted to the stores when we are also saying we don't have, we're restricting the store's existence. It feels like
Yeah.
it's a, I don't know, a
Redundant.
redundancy.
Yeah,
Yeah.
redundant.
The way I think of it is maybe because we didn't know, we're assuming, I guess how I look at it is, we don't know that the board will pass not having. So it's just a safety measure.
So we can go
I see.
through, but it makes it, that's,
Yes,
let's leave it
okay.
at that, 'cause that,
Yep.
I agree with you,
Yeah,
it should be,
Yeah.
Yeah, the board doesn't want them, so it's solidifying, it's edifying the fact that they don't want them. And then restricting the use there, right?
yeah.
Yeah, once the board decides to go
Yes.
adult
Sure.
only, yeah.
And I do think, and I can't find it now, I saw another town's name in it, in the document.
There
Oh,
was
wait,
Wayland.
Wayland.
It was
Was somewhere. It was struck?
Yes, it was.
Okay, I didn't see it.
Unless
struck.
there's another place.
No.
that is.
It was struck, yeah, I saw it,
Yeah.
Okay.
okay.
Yeah.
Oh, right.
Anything else for Pari and Cheryl
No, I think that's good.
and Marisa? So thank you for your.
I'm not
input.
leaving, I just-
No, but thank you for this.
Thank you.
And I look forward to getting that material, because there was
Yes.
some interesting things in there.
Any chance to get that
I'll send you the
updated?
soft copy, yeah. Update, they have not sent, this is the last one they have sent.
Okay, yeah, if you can send it to
Yeah.
Marisa or Heidi,
I will
they'll
send
get it out to
Sure.
us. Thank you. Anything else for them?
No.
I don't think so. Thank you.
Heidi and Cheryl, anything else?
Well, I mean, what we didn't talk about tonight is, you know, Cheryl, I'm sorry, is Kratom. I know, I see you kind of like hanging your head.
We will.
Okay.
I think that should be another evening.
I agree.
With the
Kratom,
draft
Kratom.
regulation, and it's a serious issue. I don't know
Yes,
what your
yes.
schools have been telling you,
It's another
Heidi.
product. That's,
We probably need to gather more data before we can have that conversation, but I think it's an important adjunct to this conversation. But I'd like to move forward with what we've talked about tonight and get town council, get everybody's input into the new reg, get town council to review, and then we can maybe have I don't know, we can always add on later. I don't know.
Yeah, and we will go through, Pari and I will go through some of the changes. I mean, this is a living document and there are lessons learned, and if we
Exactly.
shouldn't
Yeah,
say
for sure.
on or after, then, you know, we'll look
Yes.
at that and
Okay,
get
Yeah.
a brain cramp and
so-
figure it out.
Thank you also. You guys have been great. Thank you so much for all this input.
Okay,
Thank you
thank
so
you.
much.
Bye-bye.
Thank you, Carl.
Thank you.
Appreciate your time.
Yeah. Okay, moving on, Board of Health goals. So I took all our goals and I tried to organize them into something that was either proposed or potential.
Yeah.
Where we had a framework approved, what's ongoing and what's completed.
Okay, thank you.
Thank you so much.
Thank you. See you again.
And then, so I categorized them all that way, and then I categorized them into themes. So,
Yeah. that was good.
okay, so the idea is
Instead of just time.
some of them are ongoing and will be ongoing forever. Some we might want to add to. And so, you know, I first, very quickly, without going through them all, the legend makes sense of, you know, like where we are with all of them, and then the themes.
Yep.
If it works for you guys, my thought was we just go through one theme at a time to see if anyone wants to change anything, volunteer for anything, switch what they're doing. And I would just note the enhancement of health-related communications. What I heard today is that Greta's gonna help
Yes,
with that. So
yes, so I
I
was,
just
I was
wanted to
very
make a
happy
note of
about
that.
it. Yeah. That's really good.
Karen, just one, I don't know, not sure, so why is culling the deer population listed under climate change?
Well, hold on, I'm just doing the
Oh,
first
okay.
one first.
All right, let's start, all right.
Okay, so just Board of Health roles and responsibilities. Any updates, any changes to that one? Doesn't sound like it. Climate change, what I put under climate change was the ventilation that Maureen, we've discussed. The vector-borne diseases and vector-borne diseases
I
are
thought
both.
ventilation had more to do with like awareness from COVID. That's what I don't
yeah,
It started
understand.
there.
Infection control kind of
Yeah.
thing.
Well, but it started there, but then we closed, the COVID-related ones are sort of,
Yeah, but I'm not sure if
Why is it climate change? I don't
yeah,
get it.
I wouldn't put it, I would either put it under overall health or.
okay, that's fine.
Yeah,
But
And the vector-borne diseases, yes, that is in
Impacted.
part because of
Yes.
climate change.
or we can move all
Right.
three of those under overall health. I added climate change because
Yeah.
climate change was a proposed goal, but
Right.
it was too broad.
it's too
Oh,
broad,
yes,
so I
yeah.
would do that, Susan, I would do
Yeah,
that climate
yeah.
change, you move them under
I
overall
agree.
health for now.
Yes.
All of them, okay.
Yeah. I think it's great.
Okay, that's fine, I can do that, and then. David, to your question is, the culling of the deer population was basically wherever vector-borne diseases was
Right,
Yeah.
Was gonna be
Gotta be.
together.
Yeah, okay.
And again, it was brought up in 2025, but it's proposed potential. We've never taken it further,
That's right.
and, I should have brought a copy, I didn't today, is we came up a number of years ago with a goals framework document that asks whoever's gonna work on it to detail out what the goal is, what's the strategy, what's the benefit, what are the action items, and
What's the public health research, why is this a public health?
why is it a public health issue? So
Do
for
we have
some
that
of
in a
them,
document?
What?
Do we have them all? We should have them all.
We do.
We do, right?
we have them for all that say framework approved.
Yeah.
We do not have them
Right.
all for, we haven't had any for the
So
ones
we
that
should
were
get
left.
that to you.
Yeah.
Yeah.
Just a little bit more on that, that came out of COVID when residents were saying, what's your evidence, what are you basing that on?
Right.
What are you making your decision on, so we came up with this framework that basically says, we are doing this for this reason,
These the references.
And then
these are references.
It's the references, why is it a public health, and how do we measure it?
Yes, how do we measure it?
You know,
Absolutely.
so, we don't have a framework for any of the ones that have just a dash.
Yeah,
Okay.
those are,
Hold
Yeah.
on, so are you maintaining the culling of the deer population as a goal?
No, it's
What-
a
We-
proposed potential,
It's just potential,
we haven't voted on it yet as a goal.
right.
correct,
I mean, I,
Okay.
because no one has taken it on to do the framework
that's
and
right,
get the framework approved.
that's right. And it's so hard, the culling, well,
Well, I
can help you more about it later.
I also think that,
Well, I remember when,
Yeah.
Anne was,
Yeah.
she kind of gave a report basically saying there wasn't a lot.
Well,
The
I
state
think-
needs to do it.
yeah, I think that's what
That's
it
the
comes down to,
problem.
I think it's still on our radar to see if the state isn't gonna do something, what can we do locally, what can we
Right.
do to urge the state to do something, but I
Right.
think we decided that this cannot be a Board of Health initiative to
Right.
just do this as a goal for
It's a
us, we
big
have to
thing.
involve DPW, police, more.
And that's why it's as
Potential.
proposed or potential.
Right, so to that point, I think we could do a smaller scale, like tick drags. We could do something to like assess the conditions in Bedford, like if we wanted to kind of see what's happening in
Yeah, I
which
would love
areas,
to get a
right?
tick drag.
Yes.
right?
Yes.
And that could fall under you and I working with Heidi, because we already have, that's prevention
Oh, that's
and
right. Yeah, yeah,
control
yeah.
for vector-borne, so.
Yeah, I would
Exactly.
Actually, I would
do that.
take
Exactly.
take the culling out completely because it's under a strategy for control.
That's it. It's
You
under
know-
that. It's under that. It's a bullet point under that.
Yeah.
That's one option.
A
The other
bullet point,
option is tick
yes.
drags. The other option is evaluate data from Nantucket and Martha's Vineyard where they're looking at alpha
Oh,
gal right now. You know what I mean? I'm just saying, like, there's a
There's
lot.
lots of strategies.
Awesome.
Yeah.
And we have lots of strategies in that
Yeah.
document already.
And we'll have to expand. on that.
Actually, I have this as being Susan, but I think it was actually Maureen, you and I.
Yes, it was.
I think maybe I was just interested in the culling of the deer population.
Yeah.
But,
Okay, so I can correct that.
No, I wrote that.
Okay, yeah.
good, sorry.
We worked
I
on that.
forgot, obviously.
And you know, David, being new, you know, like, if you wanna jump in on any of these,
You can.
you definitely can, and we tend to team them.
Yeah.
Under environmental concerns, I do have an update that my understanding is the select board will be discussing leaf blowers
Yeah, I heard
on
that too.
their July
7th.
July sixth meeting.
Sixth, not 7th, yeah, I heard that.
So if I'm in town, my thought was to take our letter and read it into record,
Okay,
during public comment. If
Alright.
I am not,
I
would
will.
one of you?
I will be here.
Okay. So I just don't,
But,
but
yeah, that's a great idea.
they all have it.
Yeah,
Because it
yeah.
was shared with them, but I would like it read into public record.
I agree.
Yep,
And as you can see, all of these are proposed or potential. We've done certain activities like having the ultrafine particle forum that we co-sponsored, but all of these are just things on our radar right now.
Right.
Yeah, so from that perspective, ultrafine, I still don't have, I still don't have feedback from Massport, not MAPC, Massport, MCAC, on the process for applying for like grants to do that. They have not formulated their process yet. But hopefully this year we'll get that. Smoke from fires is really, I mean, we really can't control that locally. I feel like this is a very broad goal. It's too broad for this
I
board.
don't remember when
I
it
think
came up.
it just really falls under like our communication and like and just like amplifying out what we get from other from state and federal authorities. Like we're
Yes.
not gonna
Yes.
impact that. So I would
That's right.
I would move to strike that if I were you.
Yes. I
yeah,
agree.
I would.
Yeah,
I
and
would.
we don't need to vote on keeping these on the list or not, because they're just proposed, they're on our radar.
Right.
But when we do have a framework, that would be something that we vote to agree on the strategy and, you know, like what the plan forward is for it.
Under multi-generational?
Yeah, multi-generational,
Can
it's,
I,
well, can I just explain
Yes, I'm
a couple of things, sorry? It started with Anita and Bea had talked about mental health
Right.
and met with Chris.
Right, that's right.
And then
And ask
it,
what were the gaps and. so
right,
forth.
and then it branched out,
Right, into the multi-gen.
the
opportunities.
recreations
Recreation,
and
right.
opportunities.
Right,
And then it morphed a little bit more in some previous conversations this fiscal year about space for new construction. So I
Yeah.
just didn't know, I put them here as separate bullets.
but they're all really tied together, I would say. I think maybe we could look at the frameworks and see about updating, because that could be a next step, is to look at all our frameworks and are they.
Yeah, and I have some points on some that I wanna update, but Maureen,
I was just gonna say, I think it's redundant there. I would take out the mental health from Anita and Bea, because it morphed into something.
It did, it
Yeah, and
did.
so just leave it as.
Yeah, I agree.
Yeah,
'cause it's-
Okay, yeah, I just took them all.
Right, yes, no, no.
It's easier to pull it back.
Yep, yep.
Can I make a suggestion for that topic? Multi-generational / disability access. Because I feel like we are all interested in that and we have gotten feedback on our programs relative to that. I think it's not just about, older folks, it's about folks who are, who have like who have accessibility issues. So like if you're interested in that, let's put that there and let's make sure that every program that we put forward like takes both of those considerations into effect.
Yep,
I like
so
that,
the
Heidi.
theme,
That's really
Heidi, would
good.
be multi-generational / disability access.
Yes, that would be my recommendation.
That's really
Yep,
good.
I like it.
Okay,
And I just made a note that you'll work with Anita to update the framework.
yeah, and I guess we'll rename it then, right?
Okay.
Love it, love it.
Yep.
Okay,
The first thing, I mean, obviously, an action here is to send out all the frameworks. First of all, so David can have them and also so that we can then update them.
Yeah, so
Yeah.
Heidi, would you be able to just sort of pull together all the frameworks that we have? That we've
Yeah,
approved?
I mean, yeah, we'll review the minutes of the meeting and the text of the meeting, we'll do all that, yep.
Okay, great.
Okay,
So you could send it out before the next meeting, I mean,
Yeah,
Yeah.
that'd be great.
and then, so overall health, we are gonna move, ventilation down and the vector-borne down.
Yeah,
And the vector-borne, I know I have one asterisk, it should be 2.
Ongoing,
Yeah, because that's
right,
ongoing.
yeah.
yes.
And then, we discussed adding loneliness as a potential one, but maybe that falls under multi-generational disability access, I don't know.
I think opportunity to support mental health, I think it's under
Could be.
there.
Could be.
It feels like a really broad thing to tackle. Loneliness.
Which one?
It is.
Loneliness, yeah.
Yeah, I just think that's. beyond
So
our
should
scope.
we just
Yeah. I think
remove
we
that?
should remove it.
Yes,
Okay.
it's a huge
Uh,
component of that factor, for sure.
Yes,
yes.
Yeah.
Food insecurity, though, how are we addressing
Yes.
food insecurity?
What we did was I thought it was a completed goal because I thought it was just, didn't we write something in support of?
yeah, but at our last meeting, actually, Bea and Anita stepped up to see, because we talked about, and Heidi, correct me if I'm wrong, I think we talked about the funding to
Yeah.
help and, Bea and
So
Anita.
I
talked
think
about-
as we build, I mean, so there's a skeleton framework of a budget for this program, right? Like we
yeah.
we pay a full-time staff member and we pay so hold on. We pay a full-time staff member from the town budget. That is the only town budget contribution to the food provision program. Aside from, space, electricity, blah, 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 the vehicle that they maintain, etc. They don't pay for staff. They don't pay for the part-time staff. The town doesn't. They don't pay for the food. They don't pay for anything else. So we have to fundraise for that or grant or get, fundraise or grant fund for that. So it's a, I mean, I can do a bigger presentation on this, but like, it would be super helpful if Board of Health, Youth and Family Services, I mean, everybody who is veteran services, who's connected to the program could give some support to potentially getting more funding for this program. I mean, I've never added as I've told you, I've added fundraiser to my job. I'm not a fundraiser. I don't know how to do it. I'm trying to learn. I'm taking classes and trying to learn how to do it, but like it's become a role under HHS that like we didn't expect in our position with the pantry, who's been the primary funder for the positions, is shifting. So there's a lot going on there, and I know it's beyond what we can talk about tonight or at a future Board of Health meeting, and I hope to be more concise at a future meeting. But if we are dedicated to providing the service to the Bedford community for 250 households a week, then we
Right.
need to be committed to it, and the board can commit to it.
Right.
Yes, and they can support it. They're not the drivers of it. They're not. I'm not asking you to be the drivers of it. It's another department in HHS. But like if it's a Board of Health goal, it's helpful to have that, that stamina behind it.
Yeah, it's advocacy.
Advocacy, exactly.
Yeah, okay, no, I haven't, no, I haven't.
Yeah,
no
that was
problem
in my
with
notes from the
Staying-
last meeting.
Just staying,
Yeah, and I was like,
staying
well,
on it.
yeah,
it's
what do we-
just-
yeah.
what-
Yeah.
Okay,
Because I mean,
that's fine.
Heidi, I just am wondering, when are we gonna have to just get a line item in the town budget? And that's, I don't know if that.
Well,
will
it's
ever-
not in 2027, B, because we already have 2027 going, and we have one salary supported by that. So, yeah,
Okay.
I know.
and the
I
other
know.
part is space. We want to morph. We want to morph. All right, I'm gonna put it out there. So we're in our existing space. We've been operating a drive-through model for 6 years. It's not ideal for
Yeah.
people. It works for some people, but it doesn't work for everybody. Like, wouldn't it be a little bit better to have a market model, like where you have a market and you come when it's convenient for you, when the stores are open, whatever, blah, blah, blah. So we're now negotiating, I'll say, with access to, we've been delicately doing this because we didn't want to push the fire folks out of their station, but like, we want their station, right? Well, or we view that as a desirable space. So the town management has been gracious and has hired a contractor to evaluate that, townwide, because I know we're not the only ones that want that space, but I feel like
Right.
we're a town department. Bedford TV, is that a town department? I don't know. Like, I'm just wondering, like those the others. So if boards like the Board of Health and the Youth and Family Services Committee can like advocate for access to that space, that would be really helpful. On the back end. I mean, we will have to all work together. I'm just, we have to work together. There's the other consideration that it's a very public space. So, do people want to be public when they're coming to get food? Well, if you normalize the fact that you're coming to get food because you need it today, you might need it next week, you might need it in 2 years. Like, why don't we normalize that? Why are we making it like a blacklist, or a dark spot in the community? It should be a shining star in the community. And why wouldn't we put it forward that way? I don't know. There's a lot of talk, a lot of considerations, and I'm one person with Carla trying to make this happen and trying to force the conversation with the contractor that's been hired now to evaluate the situation. So, I think there's a lot to talk about around this topic. And
Yeah,
go ahead. So I'll stop there. Sorry.
well, maybe we need
No.
to set aside some time.
Yeah.
Yeah, well,
Yeah,
and I guess my question would be back to you, because this did come out of a previous meeting. Is this something you think you and Anita want to take on? Or we can definitely talk as a board about it, but it would be nice to have a framework.
Well, let's do the talking first and then see where we wanna go with this and then the framework.
So
You know,
I'd be interested, because
Because
you
we're coming
say,
up with strategies.
right, you say that there is a framework somewhere, so I'd be interested in seeing what that.
No, but I don't think we have a framework.
We
Why
had
is it
one-
two?
There was a framework for it, and it was awareness and advocacy.
Okay,
Okay.
all right.
Yeah.
Well,
So let's look at that.
it. Let's look
Yeah,
at
so
it,
we'll look
yeah.
at that one again. And then while we're talking about advocacy, we have a framework, Maureen, that you and I worked on for gun violence and domestic violence prevention.
Yeah,
We may wanna update
Yeah.
that framework to look more at advocacy as well.
yeah.
Yeah, I think it's a really good, like I said, the next step is really to look at those frameworks so that we can get some more
Yeah.
actions going.
And maybe what we do, like at either our next meeting or a future meeting is we just review all of the
Yes,
framework.
yes, exactly.
Or we have a need for maybe some subcommittee meetings, maybe some subcommittee meetings on these important topics that are important to the board.
Yeah,
So
exactly.
how do we do subcommittee? They have to be
Just two people?
posted, right?
Yeah, we can post it and people can come up. It's fine. Yep, absolutely. We can do that.
All right.
Yep,
But
absolutely.
I think if we get them out to everyone, then we can, like I would ask that everyone let Heidi know which ones we would need a subcommittee meeting on, and then Heidi, I can work with you on that, like, so that everything goes through her, so it's not,
Right, so it
No.
complies by town
And-
meeting law.
and, open meeting law,
Open meeting,
yeah,
sorry,
yeah.
open meeting, yes.
Yeah, and then,
And also, it gives you a chance, David, to know where you wanna come to.
where you wanna play. Yeah. And then if you go to the next page, human trafficking, Heidi has mentioned it in a number of,
Let's see what comes.
the meetings. And, like, we can then see if, like, how we can best help and support. So Heidi, I would defer to you as to when one of us or two of us should start to work with you to see if we can develop a strategy to put forth a framework.
Yes, absolutely. I'll liaise with you to move that forward. I'm in an information gathering stage right now. So
Yeah,
yes,
okay.
I expect within the next quarter to 6 months, we'll have more information.
okay.
'Cause are you thinking maybe some kind of regulation down the road, or?
I'm thinking either, well, I know I've gone, as you know, B, I've gone back and forth with like this Body Works regulation, which essentially forces them out of town. I actually don't want to force them out of town. I actually want to keep them and regulate them appropriately, or not even regulate them, but
Support.
provide supports to those who are engaged in the activities. But it's a little bit of a sticky wicket, right? So let me evaluate that a little more with other communities and how they've navigated that.
Okay, thank you.
Yeah. And the last one on this section is about the battery energy storage
Oh.
systems.
Mm.
And the question is, do we want to work with the planning board and the permitting to see if we, if we can control these types of businesses coming to town? At the MAHB, they talked about the health impact of having these sites, especially if they catch fire.
Yeah.
Well, I was gonna say, I'm like, where's the,
Is there one in Billerica?
Do we have any in Bedford now?
We do not.
We
But
do.
I
No,
think there's one in
but state regulation promotes them, and they want the locals to promote like looser regulations to allow them to happen.
Yeah.
There's
so
a
right now-
proposal. There's a proposal right now for one behind Whole Foods, a smallish one. They reap the benefits of low energy opportunities and store the energy there in their batteries, and then they sell it at a higher rate. So it's a for-profit business. But this can expand beyond this, right? I mean, this is small scale. Musk wants to put them on Mars. So so think about, there's there's a lot to digest and think about this. This is, it's a very big goal. This is a very big goal.
Well, we got a lot of research to learn.
Yeah.
Yeah, so that's another one, and one that I do add to this list, I just want to put out there, because I've had some residents ask about it, is if the Board of Health wants to come out with a statement about e-bikes.
Oh. And so, about storage and catching fire, or
Safety,
or just safety in general and all the.
children on them, adults
Oh
on
my
them,
gosh.
safety, all of that, so I want to put it on our radar as something that may be a potential.
Yeah.
So we would not regulate that. We would provide safety information, similar to like we don't regulate swim safety. We put information about swim safety. We don't regulate the PFDs, but we talk about being safe in swimming. We don't, when there's an adjunct opportunity, then we will put the safety information out there. So I think I would promote that as the goal of the board.
Yes.
Yeah.
Okay.
So in that, agreed, it's all about the safety of it. The
Yes.
enforcement would be whoever has a
Right,
regulation.
it's like,
not us.
we promote sidewalks.
Yeah,
Yes.
Yeah.
Or trail
Yeah.
connections, or like access to active activity, right? All of that. Yeah.
yep. And then I just have, listed the ones from, the COVID
And don't
review.
we want 2 stars there, because it's ongoing? I mean, with
Which one?
prioritization of COVID response evaluation action items.
Well, some of them are done.
Yeah, but the whole thing is ongoing, so you have 1 star up there, framework approved, I just wondered, okay, all right, fine.
It can be ongoing, yeah. I guess I didn't,
Well,
Yeah,
you can also parse it out and be like, we're done with COVID, but we're looking to future epidemic response.
Yes.
I mean,
Yeah,
you might,
actually,
you might,
I
you
think-
might consider that. You might consider that.
yeah, I actually didn't mean to have the star there at all.
Okay,
Cause I don't have anything on any of the others. They all have their individual.
okay, fine.
Can you guys like take a vacation? Cause you have a lot on your agenda. Like, I don't know how you're gonna get all this done, but like, this is a lot. And I love
Well,
it. And I love having the
think-
framework.
I think we prioritize, we can't do it
Yes,
all,
yeah,
you know,
we
so
gotta
I think we have to
prioritize.
look over the frameworks and then maybe take 1 or 2 of these as new goals for this year,
Right.
because we're still working
Yes.
on the other ones, you know?
Right, so I think, the ones that we have frameworks and the next or future meeting, we're just going to prioritize those. And then I'm just gonna put it out, if any of these resonate and someone wants to take them on, let Heidi know. And then, we can look
Then we
at,
can look at subcommittee meeting and all that
yeah,
stuff,
and
yeah.
see if we want to,
Yeah, to make
maybe-
them- elevate them to more goals.
yeah, maybe we want to just continue with the ones we have where we have them, and there might be something that jumps to the forefront.
Right, okay,
So, you know, my ask of, everyone would be to review all the frameworks,
Yes,
review
update
this,
them.
and then, you know, I just let
Yeah.
everyone know.
But I think that we should prioritize.
I don't know if we can prioritize today.
No,
It would be for the next meeting.
Yes, yeah.
Yeah, for a future meeting, we
Yeah.
would prioritize, update, and any new. Because like I said, there might be something that totally resonates with me, and I might just say, you know, I'm just gonna run with that, I'm gonna do a draft framework and get it to you guys
Mhm.
as part of a packet.
Yep.
But Maureen, thank you, I think it was your idea to put themes,
oh,
Yeah,
it
yeah,
helps.
yes, good. Right.
that's good.
And apologies, I know we're running over, anything else on goals before we go to the minutes?
No.
I have some things on the minutes.
Yeah, I do too.
You wanna go first, Maureen?
Sure, so on the 4th, page 3, liaison reports, I think it's council on aging,
Yes.
standard council on again. You know, and then on page 4, I'm not sure what this, the group agreed that while communication visibility as a group, a key,
Guy Schlo, I think
I'm trying to
I'm
start
sorry,
what I'm saying.
Where are you?
so on page
Communication
4,
improvements and alert
communication
signups.
improvements.
Second line,
Second line,
a key guy slow.
I don't know what that is. That's an assignment for town.
Hold on page 4, where are you? The first bullet point or no?
Third bullet point.
it says here, communication improvements and alert signups. The group agreed that while communication visibility has improved, a key die slow resident.
Sign up for
Is it
town.
go slow?
Yeah, I don't know, no.
A key goal is for
Is
residents.
residents should sign up for
Yeah,
town
sure.
alerts.
A key goal.
Should
Yes,
resident,
that
should
would be-
be.
So Danielle can review the transcript and she'll tighten that up. Yeah.
Yeah, I think that's what it was.
Thank you.
Okay.
That's great.
That's the only thing I had.
And the other thing is, on page 3, the second bullet under liaison reports.
Yeah.
Youth and Family Services Committee is working on Hope Garden, including the Happy 2 chat benches.
Oh,
Chit chat.
chit-chat. Oh, I missed that.
Yeah.
And so chart.
No, 2,
Yeah.
yeah,
Okay.
yeah, 2,
Okay.
it's not chit chat, it's 2 chat,
Oh, chit-chat.
Happy to chat. Yep.
yeah.
Okay.
And then on
7?
the 7th, any,
Yep, the initial things, I think it's the old template, so Susan, your chair,
yeah,
Oh, yeah,
yeah,
Oh, yeah.
that's all, it's just the old,
sorry about that.
that's okay. Just has to be updated. Yeah. And then, oh, yes, thank you, and then, the other thing I had was a sentence that wasn't making sense to me. Oh, where is it now? Oh, no, maybe not. Oh, yes, page 2, second paragraph. Ms. Porter noted to Mr. Nandy that if there was any aspect of what he plans to relay that is going to bring into play anything relative, it just felt like we tighten that up a bit, because I read it
Yeah.
over several times, so I'm wondering if, noted to Mr. Nandy that if, he planned to discuss anything relative to a personal situation,
Yeah,
can we just do something simple like that, because who plans to relay?
yeah, then the meeting would need to enter executive session.
Yeah, just something,
Yeah,
because I had to read it
It's
like
too
3
roundabout-
times to try
too
and
roundabout.
make sure it was.
It's
it's
too
too roundabout.
literal.
That's all, otherwise they were great,
yeah.
yeah, I didn't have anything else.
yeah.
Anyone else?
Nope.
Can I have one motion that puts them together?
I move that we, the Board of Health, adopt the minutes of May 4th and May 7th, 2026 as amended.
I'll second.
So moved by Maureen, seconded by B, all in favor?
Aye.
Aye. 400. Liaison updates? Anything?
I have contacted, Susan let me know that Sheila Metagreen is the new school committee liaison to the Board of Health.
Mhm.
And Susan had discussed with Sarah McGinley, and then I followed up with Sarah saying that I would like to be a liaison from us to the school committee, which Sarah was enthusiastic about. So I have just sent, Sheila an email just saying, we're all enthusiastic, here's my contact information, have a great summer, you know, I'll talk to you, you talk to me with issues, and, you know, I'll wait to hear back from her.
Okay,
But, you know,
Okay,
right?
great.
So that, the only other thing I think was just to keep everyone up to date on the gun violence prevention, that we're moving forward on that. Jackie has done, kudos to Jackie for all the work she has done on, our social media messaging. And so we're looking at starting in end of August to roll out a 10-month, 11-month, you know, and we divided up all the different themes and different groups, and we have our messaging with wonderful pictures and everything, and Jackie has just been marvelous, because we are all clueless about how to put things
Yeah.
into social media.
Yeah.
So we'll have that campaign starting, in the next school year, I guess.
Yeah, and the idea behind the campaign is every month or whatever frequency, just push something else out that each can be read individually and build on.
And build on.
Yeah,
And it goes to the website that Heidi and Jackie were talking about earlier, the
updated.
it's gonna be updated, because when Heidi helped with the CERT
Right.
page, it's just so much cleaner.
Yeah.
And then I
Right.
went to a grassroots for gun violence prevention presentation in Arlington, both Scott and I were there. And they were just talking about their push this year is that warrant article, and I think it might be number 1, I don't know, it's supposed to come out this month or next, the numbering, there's gonna be 10 warrant articles for the election in November, which is gonna be
Oh,
cumbersome,
oh,
to say the
yes.
least.
Oh,
At the
yes.
state level.
At
Yeah.
the state level. So, and this one is, and they've gotten approved, they've gotten all the signatures, is to repeal the 2024 new gun legislation that we worked on, that all people involved in this have worked on, that has regulations about no ghost guns, has regulations about, ERPOs, is that it, ERPOs?
emergency
Yeah,
restraining
like your
orders.
restraining orders and enlarging who can report someone, all the good stuff. And, you know, so gun groups are just upset about this. And so I think there's gonna be a lot of
Wow.
messaging that's needed for people to understand what's being repealed. If this is repealed, it'll be quite a shame because we were top of the nation for
Right.
the quality of our gun. We've now moved to second place, you know, and this would move us even further down as well as make this Commonwealth.
And I'm not
That's
sure it's, emergency restraining orders, but it's the red flag law,
It's the red flag law.
which
and-
was part of that.
Right, and so anyway, I think there is a role for, and I would work on this, a role for, is we don't need a new framework, for the Board of Health to do some advocacy in town about
Oh,
what that warrant
yeah.
article means, you know, and what
Well,
it
it's a
would mean.
ballot, it's a ballot article.
Ballot, yeah, a
Yeah.
ballot,
Yeah.
okay.
And
It's not-
A referendum, and
I think that if we just update the
Framework.
framework to talk more about advocacy,
Mm.
and I think we're gonna end up doing that with a number of our
I think we
frameworks.
are, so I think that's just, I was gonna bring it up when I gathered more information at the next meeting, just to say there'll be a role for us to, even in something like Bedford Day, to have a table to
Yes.
pass this kind of information.
Yes, yes,
So,
I think that's
That's
a
all.
really good,
That's all I have. Alright,
goal.
or articles in the citizen, stuff like that.
Yeah,
you know,
articles in the citizen,
Yeah.
yeah,
So,
holding forums,
yeah, something,
so that people they can understand, cause like, you know, you see the advertising plastering all over TV about the renter law, you know?
yes, yes,
It's like, well, what is the truth?
right, right, so anyway,
Cause that's just all big.
that's all
money.
I have, Susan.
Thank you, that's
Anything-
great. No,
Formal liaison for the two of you.
no,
Not a liaison.
Trying to think if there's anything else. Heidi, anything else?
No,
from your
you guys
perspective?
are on it. Like you guys are on it. We're like looking at these goals and we're like keeping them updated and making sure that we're like staying on the forefront of like the public health needs of the community, of the state, of the of the you know of the entire 50 states. So like I'm grateful for you, and I think there's a lot to work on. But I also feel like your understanding of like but bringing home like the bigger picture comments, but also understanding what the Bedford residents want. And I think like we're all on it, and we're supportive of you. And any way we can do whatever we can do to make that happen is where the staff wants to be. So let's continue to work together on this.
Alright,
Yeah, and I think we do. We work collectively here, but then across the departments and.
Absolutely.
Like, I don't know who brought it up earlier, is we've broadened what it means to be on the Board of Health and the Health Department. So thank you to everyone.
yeah,
With nothing else from anyone, a motion to adjourn, please.
so moved.
Second,
I'll second.
moved by Maureen and seconded by David. All in favor? Aye.
Can you do a roll call? Can you do a roll call, please?
Sure,
Yes.
sure.
David Karen.
Maureen Richichi.
Ron Course, aye.
Susan Schwartz, aye.
Thank you all.
Thank you, everyone.
Okay.
Have a good.